Hi, welcome to Project First Line for Environmental Services. This module will explore the concept of infection control. In this module, we are going to talk about what infection control is and the unique role and responsibilities that environmental services staff have in stopping the spread of germs in healthcare settings. Let's start by looking at some facts. Did you know that every day patients get infections in healthcare facilities while they are being treated for something else? This can be due to patients having existing illnesses that weaken their immune system, or they may have undergone an invasive procedure that makes them vulnerable to infection. A healthcare associated infection, or an HAI for short, is when someone gets sick with an infection while they are receiving medical care in any healthcare setting, such as a hospital, clinic, long-term or residential care facility. HAIs complicate patient care and can be very dangerous. Each day, approximately 1 in 31 U.S. patients and 1 in 43 nursing home residents contracts at least one infection associated with their healthcare. The germs that cause HAIs can live on surfaces for days or even weeks if proper cleaning and disinfection do not occur. Healthcare workers then come into contact with these germs and spread it to others and the surrounding environment. In fact, 30 to 40% of HAIs are caused by the contamination of healthcare worker hands. This is why infection control is so important, which is what we are discussing here today. Let's now talk about infection control and the important role that environmental services staff have in making the environment safe. As we begin our conversation on infection control, let's take a moment for a discussion question. What does infection control mean to you? We'll pause for a moment here to come up with some answers, and then we'll continue to explore the concept more on the next slide. What is infection control? Infection control is a set of actions that are taken to stop the spread of germs that can make us sick. Removing harmful germs from the environment protects healthcare workers, keeps patients and residents safe, and it allows for them to heal and recover from their illnesses. To prevent germs from spreading in the environment, we can take certain steps, like cleaning our hands, covering our mouth and nose with a tissue when we cough or sneeze, doing our best to not touch our face, and, of course, by cleaning and disinfecting surfaces. Poor environmental cleaning and disinfection practices can lead to harmful germs spreading, increasing the risk of contracting an HAI. This is why it's important for EVS workers to follow cleaning and disinfection guidelines. EVS personnel are the first line of defense against the spread of germs, but you also go beyond just cleaning. You are experts in knowing how to scan the surrounding environment for potential safety and health risks, which contributes significantly to infection control. Now that we have an understanding of what infection control is, let's talk about how EVS practices infection control. Here we can see some of the tasks performed by EVS staff. EVS workers create a safe environment by cleaning and disinfecting surfaces, managing linen and laundry, handling regulated medical waste, and by recognizing risks and taking action. We'll explore each category and talk about how they each contribute to infection control. The cleaning and disinfection of surfaces is a major responsibility of EVS workers and contributes significantly to infection control. High-touch surfaces such as doorknobs, light switches, and sink handles, just to name a few, get very dirty with germs over time. Those germs can be harmful to patients and residents that have a weakened immune system, which is why we follow proper cleaning practices to remove things like dust, dirt, and grime from a surface, followed by disinfection to kill the germs. The routine cleaning and disinfection of surfaces prevents harmful germs from spreading, which creates a space where patients can continue to heal and recover from their illness. Linen and laundry management. Dirty and soiled bed sheets, blankets, towels, and clothes are reservoirs for germs. These reservoirs are the places in the environment where germs live. We'll learn more about the different types of reservoirs in a later presentation. For now, it's important to know that reservoirs have a lot of germs that can spread to people. For example, a patient's or resident's bedsheet soiled with blood or other body fluids poses a risk to you and to others. The safe handling of soiled linen, followed by hand hygiene, reduces the risk of these germs spreading to people and to surfaces. To further prevent the spread of germs, used linens should always be collected in the patient's room. Handling regulated medical waste. Like dirty linen, items that are thrown away can also have blood and body fluids on them that present a risk to patients, residents, and healthcare workers, which is why it's important to properly collect and dispose of waste in order to protect yourself and others. Removing harmful waste from the environment also helps improve a patient's chance of healing and recovering. When handling waste, certain types require special handling by EVS staff to ensure safety and to prevent the further spreading of germs. This includes using designated waste receptacles for ordinary waste and regulated medical waste, which we'll cover in another presentation. Recognizing risks and taking action. EVS workers are constantly on the move. You are in and out of patient and resident rooms, staff lounges, reception, and visitor areas. You spend a lot of time walking through the halls, which means you are probably more familiar with the facility than others. You have a unique perspective and training that allows you to identify health and safety risks. When you identify a risk, such as the improper disposal of waste, dirty or broken equipment, or a slippery floor, you decide how to prioritize the issue and what action to take. We can further reduce risk by implementing standard precautions. Standard precautions are a set of infection control actions that include hand hygiene, wearing PPE such as gloves, and environmental cleaning and disinfection. These actions help prevent germs from spreading, significantly reduce the risk of infection, and promote patient and healthcare worker safety. As we wrap up with our introduction to infection control, let's think about who contributes to the health and well-being of patients and residents. We know that doctors and nurses provide direct patient care, but we also know that EVS workers are an essential part of the team by creating a clean, safe, and hygienic environment that gives a sense of comfort and aids in the healing process. As EVS staff, you are an expert in your field. Your work directly impacts patients' outcomes and their well-being. Let's take a look at our key takeaways from this presentation. Infection control actions help to stop the spread of harmful germs that make us sick and cause HAIs. Infection control actions help to create a safe and healthy environment for healthcare workers, residents, and patients. EVS staff are the experts at scanning the surrounding environment for infection risks and safety issues. Standard precautions protect healthcare workers from infection and prevent the spread of infection from patient to patient. And infection control begins with the frontline EVS staff that are trained and dedicated to maintaining a clean and safe environment. You can keep exploring these topics on your own using the resources found on this slide. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media. Thank you.